everyone, welcome back to Sowkya Medvision. In this video, we are going to start the joints of upper limb. Yes, the major joint of upper limb is shoulder joint. Yes, shoulder joint, it is a complex joint. Shoulder joint is a complex joint formed by four basic articulations. Yes, there are four basic articulations involved in the formation of complex shoulder joint. What are they? They are glenohumeral joint, acromioclavicular joint, sternoclavicular joint, and scapulothoracic articulation. These four are the articulations involved in the formation of shoulder joint. Yes, now in all these four, glenohumeral joint is the primarily articulation involved in the formation of shoulder girdle. Yes, so the shoulder girdle is mainly formed by glenohumeral joint. What is glenohumeral joint? It is a joint formed between glenoid cavity of the scapula and the head of humerus. Yes, they both form glenohumeral joint which take primary articulation in the shoulder joint. Shoulder girdle. They are involved in the formation of shoulder girdle. Yes, now let's see the shoulder joint. Yes, the shoulder joint, it is a complex joint. Yes, it is formed by head of humerus. Yes, head of humerus and glenoid cavity of the scapula. Yes, the shoulder joint is formed by head of humerus and glenoid cavity of the scapula. Is what is head of humerus? See, this is the humerus, right? This is the humerus and this is the head of humerus, and this is the scapula, lateral angle of the scapula. So this is glenoid cavity lined by glenoid labrum. This blue color is the glenoid cavity and the pink one, this pink one is the glenoid labrum, which increases the depth. Means the glenoid cavity is a shallow cavity. The glenoid labrum makes more deepens the glenoid cavity. So the shoulder joint is formed by glenohumeral joint. Yes, gleno means glenoid cavity and the head of humerus. They both are involved in the formation of glenohumeral articulation, which is the primarily involved in the formation of shoulder girdle. And now it is a movable joint, most movable joint. It is a most movable joint and less stable. Why it is most movable joint? As we know, the glenoid cavity, it is a very small. See, this is the, let's see, this is the head of humerus and this is the glenoid cavity. Where the head of humerus is very large, so that the glenoid cavity is not capable of holding the large head of humerus. So in that way, the head of humerus is easily movable in the smallest glenoid cavity. Yes, the humerus head is very large. It cannot fit into the glenoid cavity. So here it makes the joint less stable and more movable. Yes, the head of humerus can easily easily moved in the glenoid cavity. So it is less stable and most movable joint. And now it is very unstable, which is less stable joint. It is easy to dislocate. Yes, it is very prone to dislocate. Now what is the type of joint? It is a ball and socket type of joint. See, here the head of humerus and the glenoid cavity, ball and socket type of synovial joint. And now what are the articular surfaces? The articular surfaces are head of humerus and glenoid cavity of the scapula. As we discussed, the two surfaces. What are the two surfaces? One is head of humerus, another one is the glenoid cavity of the scapula. The glenoid cavity of the scapula is lined by what? Glenoid labrum. Yes. Now glenoid cavity of the scapula is lined by glenoid labrum. What is a glenoid labrum? It is a fibrocartilaginous component. Yes, it is a fibrocartilaginous component which makes the shallowed glenoid cavity, which increases the depth, deepening of glenoid cavity. Yes, now let's see the ligaments of shoulder joint. There are majorly four main ligaments of the shoulder joint. What are they? They are capsular joint, glenohumeral joint, coracohumeral joint, transverse humeral joint. Yes, capsular ligament. This capsular ligament, see, capsular ligament is present in every joint. Yes, the capsular ligament is present in every joint of the human body, every large joint of the human body. So, in this shoulder joint, the capsular joint surround the glenohumeral joint. Yes, there are four articulations. What are they? Glenohumeral joint, acromioclavicular joint, sternoclavicular joint, scapulothoracic articulation. So here the capsular ligament surrounds the glenohumeral joint. Yes, medially it is attached to glenoid cavity and laterally it is attached to anatomical neck of the humerus. Yes, there are three necks. What are the three necks of the humerus? Anatomical neck, morphological neck and the surgical neck. So medially the capsule is attached to glenoid cavity. Here we go. This is the medial side, right? This is the lateral side. So the capsule, the joint capsule is attached medially to the glenoid cavity. Yes, this is the glenoid cavity attached to glenoid cavity medially. So laterally it is attached to what? Anatomical neck of humerus. Yes, here it is attached to anatomical neck of the humerus. And now it is lined inside. The capsular ligament is lined inside by synovial membrane. Here it is lined by synovial membrane inside the capsular ligament. So next ligament is glenohumeral ligament. What is glenohumeral ligament? The ligament which extends between glenoid cavity and the humerus. Yes, it is extended between glenoid cavity and the humerus. Here we see. So the glenohumeral ligament is presented from glenoid cavity to the humerus, head of humerus. So there are three parts of glenohumeral ligament. What are they? They are superior glenohumeral ligament, middle glenohumeral ligament, inferior glenohumeral ligament. They are called superior, middle and inferior glenohumeral ligament present between glenoid cavity and the humerus, head of humerus. And now another ligament, coracohumeral ligament. Yes, coracohumeral ligament. Where it extends, where it is present? It is present between coracoid process and the humerus, head of humerus. So, the coracohumeral ligament, where it is? Here. This is a coracoid process of the scapula and this is the head of humerus. So, the coracohumeral ligament is present between the coracoid process and the head of humerus. So it is known as coracohumeral ligament. From base of coracoid process, see, from here, the base of coracoid process to anterior aspect of greater tubercle of the humerus. Yes, this is the head of humerus containing greater tubercle and the lesser tubercle. So, the greater tubercle is presented laterally and the lesser tubercle is presented medially. So, the greater tubercle from the base of coracoid process is attached to the greater tubercle of the humerus. Yes, it is known as coracohumeral ligament. And now fourth ligament is what? Transverse ligament. Transverse ligament. Transverse humeral ligament means what? It is present transversely on the humerus. Yes, see, this is a transverse ligament. It is a humerus, right? It is a humerus bone and this is the transverse ligament. This is the lateral lesser tubercle and this is a greater tubercle. It is present between these two. This is a bicipital groove. Yes, this is a bicipital groove and these are the tubercles, whereas this transverse ligament converting this bicipital groove into canal. Yes, this groove into canal. And now See, it bridges bicipital groove. As I said, it bridges. Bridges means what? It passes through. It passes above the bicipital groove. So the groove converted into canal. As it crosses bicipital groove, the groove is converted into canal to pass some structures. So what are those structures? The tendon of long head of biceps. The groove is converted into canal by what? Transverse humeral ligament. Why? To transverse some structures. What are they? Tendon of long head of biceps. Yes, these are the major ligaments of the shoulder joint, glenohumeral joint. These are the four major ligaments. What are they? Capsular ligament, glenohumeral ligament, coracohumeral ligament, and transverse humeral ligament. Apart from these four, there are some accessory ligaments. Yes, there are some accessory ligaments. What are they? Coracoacromial ligament and coracoacromial arch. What is coracoacromial ligament? See, this is a acromion process and this is a coracoid process. Can you see? Yes, I think you can see. Yes, this is a acromion process and this is a coracoid process. The ligament that is extending between acromion process and the coracoid process is known as coracoacromial ligament. Yes, the coracoacromial ligament is extended between coracoid process and the acromion process. Yes, what is the function of this ligament? What is the function of coracoacromial ligament? It protects the joint from superior aspect. Yes, it protects the joint from the superior aspect. See, this is the joint, right? This is a joint. This is present superior to the joint, above the joint. It protects the joint from superior aspect. Yes. Now, coracoacromial arch. So, this arch is formed by coracoid process, acromion process, and coracoacromial ligament. See, this is the acromion process, coracoid process, and coracoacromial ligament. All these three together known as coracoacromial arch. Yes, what are the ligaments? There are four major ligaments. Capsular ligament, glenohumeral ligament, coracohumeral ligament, transverse humeral ligament, and two accessory ligaments are coracoacromial ligament and coracoacromial arch. Now, let's see the bursas that are present in relation to the shoulder joint. There are three main bursas of the shoulder joint. What are the three main bursas? Subscapular bursa. This subscapular bursa is present between tendon of subscapularis and neck of scapula. Yes, subscapular bursa. It is presented between tendon of subscapularis and neck of scapula. Another one is subacromial ligament, subacromial bursa. Yes, where it is present? Subacromial means it is present below acromion process, right? So it is present between acromion process and the joint capsule. So it is present below the acromion process and the deltoid muscle. So it is also known as subdeltoid bursa. See, this is the acromion process. It is present. This is a joint capsule, right? So it is presented between acromion process and the joint capsule. As it is present below the acromion process, so subacromion bursa, it is presented below. This is a deltoid muscle, right? It covers from here to here. So it is also known as subdeltoid bursa. Another one is infraspinatus bursa. Where it is present? It is present between tendon of infraspinatus and posterolateral aspect of joint capsule. Where it is present? It is present between tendon of infraspinatus. There are two muscles in the dorsum of the scapula, supraspinatus and the infraspinatus. So it is present between tendon of infraspinatus and posterolateral aspect of the joint capsule. These are the three main bursas: subscapular bursa, subacromial bursa, infraspinatus bursa. So let's see the relations of shoulder joint. Now, the superiorly, the joint contains coracoacromial arch, coracoacromial bursa, supraspinatus muscle and deltoid muscle. You must remember all these relations in relation the relations of shoulder joint. Yes, you must remember all these relations. See what we have said. The superiorly shoulder joint related to coracoacromial arch. This is the joint, right? This is the joint. Superiorly coracoacromial arch is present. Yes, this is a coracoacromial arch. And subacromial bursa. See, this is a subacromial bursa present superiorly. Supraspinatus muscle and deltoid muscle. This is a supraspinatus muscle. The deltoid muscle extends from here to here. This is the deltoid muscle. This is the supraspinatus muscle. So what are the four superior aspects that are present superiorly to the joint, shoulder joint? They are coracoacromial arch, subacromial bursa, supraspinatus muscle and the deltoid muscle. These are the four aspects present superiorly to the shoulder joint. And inferiorly it contains long head of triceps, axillary nerve, posterior circumflex humeral vessels. See, this is the axillary nerve. This is the axillary nerve and this is the posterior circumflex humeral artery. These are the structures that are presented inferior aspect of the shoulder joint. Now anteriorly it related to subscapularis and subscapular bursa. Yes, it is related to subscapularis and subscapular bursa. These are the two main structures that are related anterior to the shoulder joints. Apart from these two, the coracobrachialis muscle and short head of biceps brachii and the deltoid. These three muscles are also related to shoulder joint anteriorly. Yes, posteriorly it is related to infraspinatus. Yes, infraspinatus, teres minor and deltoid muscle. See, deltoid muscle is present where it is present? It is presented superiorly, it is presented anteriorly and it is presented posteriorly also. Yes, these are the relations of shoulder joint. Now let's see the arterial supply and the nerve supply of the shoulder joint. See, the main arteries that are going to supply the shoulder joint are anterior circumflex humeral artery and posterior circumflex humeral artery. These are the two arteries that are majorly involved in the blood supply of the shoulder joint. Anterior circumflex humeral artery, posterior circumflex humeral artery. And apart from these two arteries, there are two more arteries, suprascapular artery and subscapular arteries. Yes, all these together supply the shoulder joint. You have to remember mainly anterior circumflex humeral artery and posterior circumflex humeral artery. You have to must write these two arteries in the exam paper. And now the nerve supply. The major nerve that is going to supply shoulder joint is axillary nerve. So the axillary nerve along with the shoulder joint, it also supplies deltoid muscle. We know the deltoid muscle covers complete shoulder joint. Yes, the deltoid muscle covers complete shoulder joint. So the axillary nerve not only supplies the deltoid muscle but also supplies the shoulder joint. Yes, apart from the axillary nerve, it also supplied by suprascapular nerve and musculocutaneous nerve. Yes, suprascapular nerve, musculocutaneous nerve. But you have to remember axillary nerve majorly. Majorly axillary nerve involved in the nerve supply, is involved in the nerve supply to the shoulder joint. So, as I said, it is less stable and more movable. So it is very prone to dislocation, right? So in order to make it stable, there are some factors which make the shoulder joint stable, not easy to dislocate. What are they? They are rotatory cuff muscle. There are rotatory cuff. They are also known as musculotendinous cuff. Why? They are formed by muscles and tendons. Of which muscles? There are muscles known as sits muscle. So these four muscles involved in the formation of musculotendinous cuff. These four muscles are surrounding the shoulder joint. Yes, they are surrounding the shoulder joint. So the rotate head of humerus in the, okay, now here these four muscles easily accommodate the head of humerus where it is rotated in the glenoid cavity, short glenoid cavity. Another one is coracoacromial arch, long head of biceps tendon. These two together prevents upward dislocation of the shoulder joint. What are they? Coracoacromial arch, long head of biceps. These together prevent upward dislocation of the shoulder joint. And the major one is glenoid labrum. The glenoid labrum. What is glenoid labrum? As I said, the glenoid labrum is lining the glenoid cavity, which deepens the, which increases the depth of glenoid cavity. The glenoid cavity is shallow so that the head of humerus cannot fix in the glenoid cavity. So the labrum, the glenoid labrum makes the depth, increases the depth of shallow of the glenoid cavity to make the head of humerus to fix in the glenoid cavity. So glenoid labrum deepening the glenoid cavity, it deepening the glenoid cavity. So what are the movements of the shoulder joint? It is a freely movable joint. Yes, it has more freedom of mobility. Why? The large head of humerus is fixed in the small shallow cavity, that is glenoid cavity. So it has more mobility and less stability. Yes, laxity of joint capsule and large head and small and shallow glenoid cavity makes the joint more freedom of mobility. Yes, now let's see the movements. What are the muscles involved in the movements of the joint, shoulder joint? What are the major movements of the shoulder joint? See, the shoulder joint is involved, is having almost all movements. It is involved in the flexion, extension, abduction, adduction, medial rotation, lateral rotation, and finally circumduction. So what are the muscles involved in the flexion movement? They are major muscles involved in the flexion movement are pectoralis major and deltoid muscle. Yes, these are the two muscles involved in the flexion of the shoulder joint. What are the primary muscles involved in the extension of the shoulder joint? They are deltoid muscle and latissimus dorsi. Latissimus dorsi. Now, what are the muscles involved in the abduction? The muscles involved in the abduction are deltoid muscle. See, these are the major muscles. There are some accessory muscles also, but you have to remember these muscles and write these muscles in the exam. And the muscles involved in the abduction are deltoid, and the muscle involved in the adduction are pectoralis major and latissimus dorsi. Now, what are the muscles involved in the medial rotation? The muscle involved is subscapularis. What is the muscle involved in the lateral rotation? Once again, deltoid muscle. So, the muscles involved in the flexion are pectoralis major and the deltoid muscle. Pectoralis major and deltoid muscle. In the muscles involved in the extension are deltoid and latissimus dorsi. Muscles involved in the abduction, deltoid muscle. Muscles involved in the adduction, pectoralis major and once again latissimus dorsi. Muscles involved in the medial rotation are subscapularis, and muscles involved in the lateral rotation, it is once again deltoid. Now, all these muscles together involved in the circumduction. Yes, involved in the circumduction. So, the shoulder joint having all the movements, flexion, extension, abduction, adduction, medial rotation and lateral rotation, finally circumduction. So the shoulder joint, it is a major joint. Yes, it is a major joint that is present in the upper limb. It is a ball and socket type of joint. Yes, it is ball and socket type of joint. It is a joint formed between head of humerus, the large head of humerus, and the small shallow glenoid cavity. Yes, and it is a ball and socket type of joint. The four ligaments are capsular ligament, glenohumeral ligament, coracohumeral ligament and transverse humeral ligament. Apart from these four, there are two accessory ligaments. They are coracoacromial ligament and coracoacromial arch. And now, what are the nerve supply and the blood supply to the joint? There are two major arteries. What are the anterior circumflex humeral artery, posterior circumflex humeral artery, and the major nerve supply is by axillary nerve. What is the factors that are involved in the stability to make stability the shoulder joint? They are rotatory cuff formed by four major muscles and coracoacromial arch, long head of biceps tendon which prevents upward dislocation of the joint, and the major factor is by glenoid labrum. Yes, it deepens the glenoid cavity. And what are the movements of the shoulder joint? Flexion, extension, abduction, adduction, medial rotation, lateral rotation, and finally circumduction. Yes, this is the complete shoulder joint. If you have any doubt, please comment in the comment section. And please support the channel, like the video and subscribe. Namaste.